Hello and welcome back to HBB, Strictly Education. So today we're going to talk about hypertension and we're going to talk about a calcium deficiency versus salt. And we're going to talk about what's better, liquid or capsules when it comes to calcium. So in this video, we're going to look at this from a naturopathic point of view. Many people, the majority of people that take blood pressure pills, start taking them and they never get off. They're only subscribe them over and over and over again, but they're never taken off. So we want to look at this from a naturopathic point of view and see if we can see some differences here. Hypertension. So what is hypertension? Hypertension occurs when the force of blood against the artery walls is consistently too high. In naturopathic medicine, this view is not just a number, but it's a sign that the body systems are out of balance. Calcium and hypertension. From a naturopathic's perspective, calcium deficiency is considered a potential contributor to hypertension. Now, for years, we've been told that high blood pressure comes from too much salt. But my grandmother omitted salt and foods with high sodium content, but her blood pressure was still high. Calcium's roles. Calcium is crucial for proper muscle function, including the muscles in our blood vessels. Adequate calcium helps blood vessels contract and relax efficiently. So check out the video on calcium and magnesium in the playlist on the channel. I dedicated a whole video to just calcium and magnesium. Blood pressure regulation. Some naturopathic practitioners believe that low calcium levels may cause blood vessels to constrict, potentially leading to increased blood pressure. So if you have a deficiency of calcium, this is where high blood pressure may take place in the body. Hormonal impact. Calcium deficiency can affect hormones that regulate blood pressure, such as parathyroid hormone. So if you check in the playlist, you'll see that I just did a video on why is the thyroid so important. So you really should check that out. What are the differences in calcium? So first, let's start with calcium liquid. It's generally well absorbed, especially for those with digestive issues. So it could be easier to swallow for those who have difficulty with pills. It allows for more precise dosing, so you can get, if it says 1 ounce is easier, it's liquid, 1 ounce to 2 ounces, easier to dose, to do a dosage. Often combined with other minerals, better absorption, and may have a chalky taste or texture, but I find that when I add it to juice or something like that, I don't have a problem. What are the differences in calcium? So now we're talking about calcium plus vitamin D3. So this is a combination which includes both the calcium and the vitamin D3. Now, the vitamin D3 aids in calcium absorption, so it helps the body to absorb the calcium better. Now, both nutrients are crucial for bone health, right? Provides essential nutrients and 2 essential nutrients and 1 supplement. Now, usually in a pill or tablet form, but I prefer liquid. It may require a larger pill due to the combination of, being 2 different supplements. So it might need a larger pill. Nobody wants that. Calcium pills, usually calcium carbonated or calcium citrate. Calcium carbonate, higher concentrations of elemental calcium, best taken with food. Calcium citrate is lower concentration, but can be taken with or without food. Dosage often requires multiple pills per day to meet recommended intake. It's cost effective, generally most affordable option. Storage is longer shelf life compared to liquid forms. So let's be clear about something when it comes to the pills. I'm not a fan of the calcium pills for really anybody, because calcium pills, if you take the calcium pills, okay, it requires stomach acid for absorption and is best taken with food, right? But then your body only typically absorbs about 30 to 40% of that calcium, okay? Now, calcium citrate, the calcium citrate is more easily absorbed and can be taken with or without food. And then you only absorb around 20 to 30% of that calcium. So really whereas if you're taking liquid and it says you're taking about 500 milligrams, then with the liquid, you're going to get 500 milligrams. But if you take the pill, you're not going to get that full 500 milligrams out of that pill. You're only going to get 30 to 40%, right? Or that 20 to 30%, depending on which ones you take. And again, whether you're taking it with food or without food. So there is a difference there when it comes to the pills. Key considerations. Absorption rate can vary. Liquid forms may be absorbed more quickly, but not necessarily more effectively overall. Individual needs. The best form depends on the person's age, health status, and specific deficiencies. Interactions with medication. Calcium can interfere with certain medications, so timing of dosage is important. Potential side effects. All forms can cause constipation or other digestive issues in some people. Quality and purity. It is important that you choose a reputable brand regardless of the form. Always choose a reputable brand. Go online, look at the reviews, because some people will take supplements that are full of nothing, and you go to the bathroom as quick as you take them, you poop them out. So you want to make sure that these are chelated supplements. So talking about what would cause uh, supplements, these calcium not to be able to be absorbed in the body. You can have digestive issues, potential health risk, interaction with other medications, bioavailability, meaning being able to be absorbed, and types of calcium and timing, the types of calcium that you get and the timing. So sometimes splitting the dosage into smaller dosage will help, throughout the day will help with absorption. So you want to give that a shot. Well, guys, we have come to the end of our video, and I hope that you guys picked up a little something here and there to learn a little bit more about your bodies and health. So I will see you guys in the next video.